Hi and welcome to the channel. Audience of my anatomy series may be wondering what happened to the series. Yes, no, it isn't stopped. It is always my core subject, but I got a little bit busy with the pathology series that there came a short break. We will set that right now. We will restart the series today. We were discussing topics of neuroanatomy then. I had promised a few more classes on neuroanatomy too. But for the time being, we will leave that there and we will brush up some embryology. Embryology is my favorite section in anatomy, and for you, I will divide the entire syllabus of embryology into seasons and episodes. Yes, of course, theaters and movies, multiplex, such things are not in trend now. What is in trend is Netflix series. Yes, following the trend, we will make our embryology also into a series of seasons and episodes. The syllabus of embryology is broadly grouped as general embryology and systemic embryology. General embryology refers to the first 8 weeks of pregnancy. It is the most busy period. So much happens during this time. A single cell zygote is converted into a form which more or less resembles the adult features. And this all happens in the first 8 weeks. And that is the subject of general embryology. Systemic embryology refers to the functional maturation of the organ systems already formed. In our series on embryology, season 1 will be pertaining to the general embryology. That is the first 8 weeks. Each major event happening in this period or in this season will form the subject of each episode. Today, in this video, we will start our series on embryology with a prologue describing what is embryology, followed by season 1, episode 1. Season 1, general embryology. Episode 1, of course, is fertilization. Okay, enough of introduction. Let's open our series on embryology. Okay, let's start our grand series on embryology with a prologue, introduction to embryology. So what is embryology? Embryology is the study of development and growth of individual within female genital tract. Technically, a life starts as soon as a sperm meets the ovum, that is fertilization. The development and growth of that life from that point to birth, that is the subject matter of embryology. So it is the study of growth and development of the individual within female genital tract, that is the period from fertilization to birth. As I told you, development is a continuous process which starts from the day of fertilization up to about 25 years of age. And this period is broadly classified into prenatal and postnatal. Prenatal is the period from fertilization to birth, which, as I told you, is the subject matter of embryology. And postnatal development occurs from the time of birth to about 25 years. The prenatal period is again divided into embryonic period and fetal period. The terms embryo and fetus are often interchanged by laymen. But as medical students, you must know the difference. Both are not the same. The embryonic period, or the period when the life is referred to as embryo, is from fertilization to about 8th week. That is roughly 2 months. This is the time when the life is called embryo, and this is the subject matter of our season 1. This embryonic period is again subdivided into pre-embryonic period, which is from fertilization up to 2nd week, and embryonic period proper, which is from 3rd week to 8th week. The fetal period, which is the period when the life is referred to as fetus, extends from about 9th week, that is after the embryonic period, to the birth. Even the postnatal period is divided into phases. The time period from birth to first year is called infancy. That is the period when the newborn can be technically called infant. The part of infancy, that is from birth to about 4th week, that is roughly 1 month, is called the neonatal period. And there is another term, that is perinatal, which is used clinically. This period is 28th week intrauterine to about 6th day after birth. This time there is 28th week is because it is after this time, that is after 28th week, is the fetus viable. It is only after 28th week is the fetus viable when given birth to. So this period, that is from 28th week up to 6th day after birth, is referred to as perinatal period. Childhood is the period from 2nd year to about 12th year. It is at this stage that you can call the individual a child. Puberty or pubertal period is from 13th to 16th year, and adolescence is the period from 17th to 18th year. I suppose most of my audience here would be from this age group, and the period of adulthood is from 19th to about 25th year. So what happens after 25th? Of course, even after 25th year, the individual is called an adult. But of course, we are talking here about the phases of development. Now coming to subdivisions of embryology. As I told you, the syllabus of embryology is divided into general embryology and systemic embryology. General embryology is our season 1, that is from embryonic period up to 8th week, where so much happens. And systemic embryology is functional maturation of various organ systems already formed in the general embryology period. There are also other subdivisions like descriptive embryology, comparative embryology, experimental embryology. We will not go into them now. But of course, teratology is the study of abnormalities. We will see that as clinical relevance with each topic. So that's the end of prologue. Let's move on to embryology season 1, fertilization to gastrulation, episode 1, fertilization, shortly S1E1 fertilization. Fertilization is the process of fusion of male and female gametes to form zygote. Fertilization is the fusion of male and female gametes to form zygote. It occurs within 24 hours of ovulation, and the site of occurrence is ampulla of uterine tube. Fertilization occurs when the male gamete, the sperm, meets the female gamete, the ovum, and this occurs at the ampulla of the uterine tube, which is part of the female reproductive system. I think now we need a diagram here. Let's quickly draw a diagram section of female reproductive system with our hero sperm and heroine ovum inside. Okay, so this is the diagram of section of female reproductive system with our hero sperm and heroine ovum inside, vagina, uterus, uterine tube or fallopian tube. With this region here, the bend here is called ampulla of the uterine tube, ovary here, and our hero sperm is here. I think for embryology, we will need to add the third dimension for better understanding. So let's bring in the third dimension and convert this diagram into a passable 3D animation. Kind of passable animation which is possible with the machine in hand. Okay, here we got the 3D model. For the fertilization to happen, first the male and female gametes should meet each other. That is, approximation of gametes should occur. That is, our hero sperm should meet our heroine ovum. There are certain factors or forces which bring about this approximation. We will discuss about that now. Yes, for our hero to meet our heroine, there should be some factors. Yes, there should be a medical college, there should be an anatomy department, and of course, there should be a dissection hall with seats in the same dissection table. Yes, that's where most heroes meet their heroines. Yes, same way, there are certain factors which bring our sperm close to the ovum. The sperm here is already in the vagina. How the sperm reaches the vagina, I'm sure you're all adult enough to know that, and that's not our subject matter, by the way, but we will follow its journey from this point. From vagina, the sperm movement up to the isthmus of uterus, that is the part of the uterine tube within the uterine wall, this constricted region here is the isthmus of uterus. The sperm movement from the vagina up to the isthmus of uterus is caused by inherent propulsive action of the sperm tail. As you all know, the sperm tail, like tadpoles, have an inherent propulsive action, referred to as sperm motility. One of the factors which cause sperm movement up to the isthmus of uterus is inherent propulsive action of the sperm tail. Another factor is sucking in action due to uterine contractions brought about by prostaglandins in semen and oxytocin released by pituitary, it is female pituitary. And this is also aided by movement of uterine cilia. Anyways, this takes about 2 to 7 hours for the sperm to move from vagina through the uterus into the region called isthmus of uterus. Now coming to our heroine, that is the oocyte, which is released from the ovary during ovulation. This oocyte reaches the ambula or bend of the uterine tube due to movement of cilia and contraction of smooth muscles of the uterine tube. There is no inherent propulsive action for ovum. It only moves up to the ambula due to movement of cilia and contraction of smooth muscles of the uterine tube. Now our ovum is already at the ambula and your sperm is still in the isthmus of uterus. The sperm movement from the isthmus up to the ambula of uterus is brought about by chemoattractants produced by cumulus cells surrounding the oocyte. It is brought about only by the action of chemoattractants produced by cumulus. So without the ovum and the cumulus cells surrounding it, and without the chemoattractant chemicals produced by the cumulus cells surrounding it, the sperm will not cross the isthmus and reach the ambula. So for the sperm to cross this part, it needs the ovum at the ambula. Of course, like in our story, our hero may not go to the dissection hall without the heroine already there in the dissection table. Yes, he might not go to the dissection hall itself. He might bunk the class because who wants to hear the boring demonstration of professors? Yes, so only when our heroine ovum is already there in the ambula, our hero sperm crosses the isthmus and reaches the ampulla. So now both sperm and ovum is at the ampulla and they come face to face with each other. But does the fertilization occur immediately? No. For the fertilization to occur, our sperm has to cross three more barriers called fertilization barriers. Of course, in our story also, even if both are there in the dissection hall at the same dissection table, our hero, in order to make the move, should cross certain barriers, right? Like, for instance, the prying eyes of the dissection hall attenders or assistant professors. Yes, the same way, our sperm also, in order to fertilize the ovum, has to cross three barriers, together called fertilization barriers. These are: number one, cells of corona radiata; number two, zona pellucida; and number three, vitelline membrane or plasma membrane of the oocyte itself. Normally, the sperm does not have the capacity to cross these barriers. It needs to undergo a process called capacitation to get the ability to cross these barriers. Of course, like our hero who needs proper time, space, and cues from the heroine to make the first move. Yes, the same way the sperm needs to get capacitated to get the ability to penetrate the fertilization barriers. How it occurs this ability? By the process called capacitation, which is nothing but conditioning of sperm in female genital tract. What happens in this conditioning? The glycoprotein coat and seminal plasma proteins covering the plasma membrane of sperm in the acrosomal, that is the spearhead region. Yes, the acrosomal region is removed. The glycoprotein coat and seminal plasma proteins covering the plasma membrane of sperm in the acrosomal region is removed. And this process is called capacitation. And only after this capacitation, the sperm gets the ability to penetrate the fertilization barriers. Now coming to the steps in fertilization, the first step is the penetration of corona radiata. The sperm, that is capacitated sperm, penetrates the corona radiata. The next step is penetration of zona pellucida. This is brought about by a reaction called acrosome reaction. When a capacited sperm contacts the zona pellucida, acrosome reaction takes place. During acrosomic reaction, hyaluronidase and acrosin are released from acrosomic cup of sperm, and there occurs an antigen-antibody reaction between oocytes fertilizing and sperms anti-fertilizing. This antigen antibody, that is fertilizing and anti-fertilizing, are specific for each species, and that's why even if copulation takes place, fertilization does not occur between different species. So species specific antigen antibody reaction between oocytes fertilizing and sperms anti-fertilizing occurs, and there is a release of enzymes causing lysis of zona pellucida around the sperm. The entire zona pellucida does not disappear. There is only lysis around that point around the sperm, and through this the sperm penetrates the zona pellucida. As soon as the sperm penetrates, there occurs another reaction called zona reaction, and this reaction occurs in the zona pellucida. Of course, why should boys have all the fun? So for its part, zona reaction occurs in the zona pellucida, and this reaction makes it impermeable to any other sperm. So only one sperm is allowed, and after that zona reaction occurs and it becomes impermeable to any other sperm. The next barrier to be crossed is the vitelline membrane of the ovum. The vitelline membrane breaks down at the site of fusion, and the head of the sperm enters the cytoplasm of the oocyte. Body and tail are discarded. By the way, during this course on embryology, we will dispel certain myths which are usually carried by laymen. Laymen can carry myths, but as medical students, there is no place for myths. The common layman belief when they think about the sperm fertilizing the ovum might be that the entire sperm enters the ovum. But that is not true. The truth is only the head of the sperm enters the ovum or cytoplasm of the oocyte. The body and tail are discarded. As soon as the head enters the cytoplasm, there occurs another reaction, and this time it is in the cytoplasm of the ovum, and this is called calcium wave. And this calcium wave also prevents other sperms from entering the ovum. So both zona reaction and calcium wave become double layer of protection, preventing another sperm from entering the ovum. So now the sperm has crossed the 3 fertilization barriers and it is already inside the ovum. The sperm nucleus transforms itself into male pronucleus. Now the next step is formation of female pronucleus. As you already know, the process of second meiotic division is midway while ovulation takes place, and the second meiotic division is arrested at the stage of metaphase until the fertilization occurs. So only penetration of sperm induces the oocyte to complete the second meiotic division, and mature oocyte is formed and second polar body is extruded. Now the maternal chromosomes of mature oocyte condense to form female pronucleus. So we have the female pronucleus and male pronucleus, each with haploid number of chromosomes, that is 23 chromosomes within the ovum. Now layman thinking is that this 23 plus 23 mixed together to form 46. No, that is not true. Both these pronuclei, that is male and female pronuclei, first replicate DNA to form diploid from haploid. That is, each 23 first becomes 46. Only after this, the chromosomes of the two nuclei mix. That is, there is mixing of 46 male plus 46 female chromosomes. And after mixing, it is called zygote. Now, cleavage spindle forms and the chromosomes split and sister chromatids move to the opposite poles. That is, a set of 46 chromosomes each moves to each pole. And now, cytoplasmic furrow appears and the zygote divides into two cells. Time to dispel another myth. In humans, there is no strict single cell stage. That is, haploid chromosomes of each pronucleus first duplicate to form diploid, and then they mix and a set of 46 chromosome moves to each pole, and the ovum divides into two diploid cells. There is no 23 plus 23 46 single cell zygote. Contrary to common belief, there is no single cell stage zygote. Coming to results of fertilization, of course, fertilization causes completion of second meiotic division of female gamete. It restores the diploid number of chromosomes. Fertilization also forms initiation of cleavage. As I told you, there is no single cell stage. At the end of fertilization itself, we have two cells. So the cleavage has already started. Determination of sex. Of course, I suppose you already know. It depends whether the sperm is X or Y. And the mixing of chromosomes also bring about variation within and between species. And coming to clinical correlation part, what we have to know is about in vitro fertilization. What we discussed up to this is in vivo or natural fertilization. In cases where natural fertilization is not possible due to some clinical condition, in vitro fertilization is attempted, commonly and colloquially referred to as test tube baby. In vitro fertilization, several mature oocytes are collected by needle aspiration from ovarian follicles. Sperm is separated from seminal fluid and it is capacitated artificially by exposure to ionic solutions. I told you sperm gets capacitated only in the female genital tract. Here that is done artificially using ionic solution. And then both are added to the culture medium. Cleavage is allowed in vitro, that is in the lab itself, up to 8 cell stage, and at least 3 8 cell stage embryos are transferred into the womb of the mother, or if the mother has some clinical condition, into the uterus of the surrogate mother. And as commonly said, rest is history. This brings our first episode to the end. In the next episode, we will follow the story further. We will discuss the next stages, that is cleavage, formation of morula and blastocyst. As usual, notes are available for download in the description, and for further guidance you can mail me. Until we meet in the next episode, thanks for watching. Bye.